Hi, Bridges for the Deaf and Hard of Hearing wants to share information about the proposed health care bill with you. As you know, the House of Representatives passed a bill called the American Health Care Act. A Senate committee then proposed a bill called the Better Care Reconciliation Act. We made a previous video about that bill. Because the Senate did not have enough votes to pass the Better Care Reconciliation Act, they chose not to vote on it and tried to make some changes to the bill. This video is to tell you about the changes and how the bills compare to each other now and to the Affordable Care Act that is the law right now. Bridges for the Deaf and Hard of Hearing is not supporting any of the bills. This information was put together by NPR, National Public Radio. We want you to have the information so that you can decide whether you support or oppose the bill. Then we hope you will contact your elected representatives and senators to let them know how you feel. For people under the age of 26, the Affordable Care Act, or Obamacare, can get insurance through a parent's plan or buy independently. With the House bill, the American Care Act, it stays the same. And with the Senate bill, Better Care Reconciliation Act, it stays the same. For adults under the age of 65, the Affordable Care Act, or Obamacare, can buy insurance through health exchanges with tax credits and subsidies if they meet income requirements up to 400% of poverty level. The cost of insurance is based on tobacco use and age, with people nearing 65 paying no more than 3 times what the youngest pay. Premiums can't cost more than 9.5% of income. Those with very low or no income qualify for Medicaid. So the House bill, the American Health Care Act, you will see tax credits to pay premiums based on age, not income, that max out at $4,000, much less than under the ACA. The oldest people under 65 can be charged 5 times more than the youngest, maybe more depending on state rules. Medicaid is cut after 2020. For the Senate bill, it's the Better Care Reconciliation Act. The CBO report says 22 million people would lose health insurance over the next 10 years, with people between 50 and 64 disproportionately impacted. The oldest people under 65 would pay 5 times more than younger people on the exchanges. Subsidies to help pay for insurance would be less and end at incomes of 350% of poverty level. Federal contributions to Medicaid start to decline in fiscal year 2020. There's been a July 13th update. The new draft will let subsidies be used to buy plans that offer only catastrophic care and would let consumers use health savings account to pay premiums. If you are a low-income nursing home resident under the Affordable Care Act or Obamacare, skilled nursing care is covered by Medicare up to 100 days per illness. Medicaid is available based on income. For the House bill, the American Health Care Act, skilled nursing care is covered by Medicare up to 100 days per illness. Medicaid services or payments to nursing homes could be cut as states see federal funding decline. For the Senate bill, the Better Care Reconciliation Act, skilled nursing care is covered by Medicare up to 100 days per illness. Medicaid coverage for nursing home services and payments to nursing homes could be cut as federal payments to states decline. This is for people who have pre-existing medical conditions. Under the Affordable Care Act or Obamacare, coverage cannot be denied, nor can costs increase. With the House bill, the American Health Care Act, states can get permission to let insurers charge more for some pre-existing conditions and to exclude some people altogether. States would have access to federal money to help those with expensive policies or conditions. With the Senate bill, the Better Care Reconciliation Act, insurance companies would be required to accept all applicants regardless of health status. But the draft bill lets states ask permission to reduce required coverage, also called essential health benefits, which would give insurers some discretion over what they offer in their plans. That could result in substantial increases in costs for people who want those services, according to the CBO. If a particular benefit is no longer classified as essential, insurers could impose annual and/or lifetime limits on what they spend on patients for that benefit. And caps on the annual out-of-pocket costs for patients would no longer apply. There's been an update as of July 13th. New language would end protections for people with pre-existing conditions by letting insurance companies sell plans that don't include the ACA's essential health benefits, as long as an insurer also offers a plan with those benefits on the exchange. Analysts and insurers warn that this could create two markets, one for sick people who need more benefits and one for healthy people who need fewer. That would drive the cost of insurance much higher for people who want more benefits, including people with pre-existing conditions. Subsidies would be available for lower income people to buy a comprehensive plan, but out-of-pocket costs would still go up for them, probably by a lot. This applies to those who go to Planned Parenthood. Under the Affordable Care Act, or Obamacare, federal programs reimburse for most Planned Parenthood services, with the exception of abortions. With the House bill, the American Health Care Act, a one-year block will be placed on federal reimbursements for health care provided by Planned Parenthood. For the Senate bill, the Better Care Reconciliation Act, a one-year block will be placed on federal reimbursements for care provided by Planned Parenthood. The CBO estimates 15% of women will lose access to family planning care, increasing birth rates and Medicaid spending for childbirth and children's insurance. But those increases would be offset by Planned Parenthood cuts. This is for people with disabilities. The majority of Medicaid dollars go to people with disabilities. With the Affordable Care Act, or Obamacare, those individuals may qualify for Medicare and also Medicaid. With the House bill, the American Health Care Act, services covered by Medicaid could be cut as federal funding to states declines over time. With the Senate bill, the Better Care Reconciliation Act, services covered by Medicaid could be cut as funding to states declines over time. The CBO report suggests that by 2026, Medicaid enrollment would fall by more than 15 million people. This is for people who use mental health services. Under the Affordable Care Act, or Obamacare, this is covered by all plans under essential health benefits. With the House bill, or the American Health Care Act, those individuals could lose coverage in states that get waivers from covering essential health benefits. For the Senate bill, the Better Care Reconciliation Act, states could request waivers to opt out of requiring essential health benefits. If a state opted out of coverage for mental health care, insurance that includes mental health care coverage could become extremely expensive, according to the CBO. This is for the working poor on Medicaid. With the Affordable Care Act, or Obamacare, 31 states and the District of Columbia offer expanded Medicaid coverage. For the House bill, the American Health Care Act, federal funding for Medicaid expansion phases out, potentially affecting millions of people who are currently enrolled under the expansion. For the Senate bill, the Better Care Reconciliation Act, Federal funding for Medicaid expansion phases out between 2021 and 2023. In addition, 8 states would have a trigger clause. If the federal matching rate declines below the ACA promised rates, the expansion goes away immediately in Arkansas, Illinois, Indiana, Michigan, Montana, New Hampshire, New Mexico, and Washington. Further reductions would start in 2025. In a separate provision, states could impose a work requirement on recipients. Most able-bodied adult Medicaid recipients already work. This is for the wealthy. Under the Affordable Care Act, or Obamacare, they would pay extra taxes to support the ACA. Under the House bill, the American Health Care Act, the bill would repeal ACA taxes on corporations and cut taxes for the wealthy by about $592 billion. For the Senate bill, the Better Care Reconciliation Act. It is similar to the House bill. It would repeal ACA taxes on corporations and the wealthy that pay for insurance subsidies. That would add up to about $563 billion in tax cuts over 10 years, according to the CBO. From the July 13th update, the revised version keeps some of the ACA's taxes on higher income people. But the permission for flexible spending accounts to be used for premium payments will be a tax advantage for those who can afford to put money aside in those accounts. National Public Radio says those plans would very likely be cheaper than the policies currently offered on the Obamacare exchanges. But for people who would like to purchase plans that cover the essential health benefits mandated by the Affordable Care Act, including mental health coverage, addiction treatment, maternity care, and prescription drug coverage, costs would go way up. The nonpartisan Congressional Budget Office hasn't yet analyzed the new bill. It weighed in on the earlier Senate bill, saying that proposals would result in 22 million fewer people having health care coverage in the next 10 years, compared with the Affordable Care Act. Of those, 15 million would lose Medicaid coverage. That version was projected to lower the deficit by billions over 10 years. But that may have changed as the latest version offers billions more for state grants and also doesn't repeal as many of the Obamacare taxes. Yet, this new variant is the same as its predecessor when it comes to subsidies to help individuals pay for insurance. It would mostly reduce subsidies and cause out-of-pocket costs to rise, as the CBO said about the previous bill. It's not yet clear how the state grants would alter that dynamic. Also, according to a report by PBS, the Public Broadcasting System, America's Healthcare Plans, and Blue Cross Blue Shield of Tennessee issued a joint letter opposed to the Senate bill, the Better Health Care Reconciliation Act. It is simply unworkable in any form, the letter said. They said it would undermine protections for those with pre-existing medical conditions, increase premiums, and lead many to lose coverage. Insurance affects everyone, including you. Make sure you understand what is being proposed and decide whether or not you support it. Then contact your senators and representatives. To find them and to see a video on the best ways to contact them, please visit our website at bridgesfordeafandhh.org. Under the tab Get Involved, click on Legislative Advocacy. You will see the video and links to reach your senators and representatives. Thank you.